No matter
which is
what insurance you got, I should be able to go to
law.
any hospital that I want in any city that I want and get any care that I want, and I should see the best doctor, and my care should be exactly the
So,
same.
so the phrase needs to change. It's not healthcare is a right, which the Democratic Party uses. The actual phrase is equal healthcare is a right. Aaron,
Yes.
why don't you start by introducing Academy Health and yourself and your background?
I'm Aaron Carroll. I'm a pediatrician and health services researcher by training. Health services research is basically a body of work that studies how do we improve the access, quality, and cost of the healthcare system. Instead of like trying to figure out what can work, we actually figure out how does it work in the real world. How do we make sure that the care that people need is available, they can access it, that it's producing high quality, that it's there at affordable costs. That's basically what health services research is.
We have this strange dichotomy here of 6,000 hospitals, 5,000 of which have got nothing to do with the government. They are for profit or hiding the fact that they're for profit.
Correct.
It's just either option A or B. Let's
Right.
not kid ourselves. Any other OECD country that you look at, more or less, that ratio is inversed.
Yep.
So we stand alone with these 5,000, 80 to 90% not government run, catastrophic care, high acuity, most expensive. Let's go make a fortune, boys and girls. Talk to me about how wrong you think that is and why you feel confident in that theory.
So, ironically enough, every other country that I have been to, and I've been to lots of them looking at their healthcare systems, explicitly tiers. Like they're comfortable with it. Like we have this, which is basic and it's good and it doesn't have a lot of bells and whistles and there's lots of stuff you might not love about it.
And you're describing an actual hospital, basic hospital.
Good enough, and it's cheap. And the vast majority of people choose it. But with the exception of really Canada, everybody else is like, you don't like that and you want to spend your own money, you can go over there and buy private insurance or don't buy private insurance.
Luxury hospitals for luxury
and
people.
They are, I mean, private had a cigar bar in the lobby. I mean, it was spectacular. I don't know that it was affecting people's care, but you can choose.
Probably not in the right way.
If you go to Singapore, every time you get admitted, you literally have to tell them what tier. And there's like A minus, B plus, B2 plus, C. So it's like, and if you choose A, it's great. 100% out of pocket. You choose tier C, probably the government, the insurance, the catastrophic insurance will cover all of it. But if you choose tier C, you're in a big ward room, 10 people, sharing a bathroom, air conditioning, whatever doctor covers by, but you make an explicit choice. Here, we think everyone should get anything that they want.
So it's interesting that you're saying that because it's two layers of it. One is 100% access. Everyone gets healthcare, which I'd stand behind. I think that's a noble cause, except that we have 350 million people and 150 million of them can't afford much. So that is a real budget undertaking. Two is not only we will give you all access, but you're all going to get the best care in Maximum.
Right. No matter what insurance you got, I should be able to go to any hospital that I want in any city that I want and get any care that I want, and I should see the best doctor, and my care should be exactly the same.
So the phrase needs to change. It's not healthcare is a right, which the Democratic Party uses. The actual phrase is equal healthcare is a right.
Well, I think equal healthcare is like, that's where I'd be like, what do we mean by equal? I do think that like, I actually am comfortable with the idea that we should have a right to healthcare in the sense that it's like an organizing principle, whatever you want to pick your Rawlsian, that there should be an equality of opportunity. Like everyone should have a baseline of like, this is what it means to get healthcare. But in no other country, private, public, totally socialized, anything, is there an expectation of if there's a phenomenal hospital over there, I should get this, I should absolutely have a right to